Welcome to Greenville Technical College Injection Procedures. Now today I'll show you some different devices that we'll use for injections. You will follow your facility's policies and procedures. Make sure you do complete hand washing prior to gloving. I've already washed my hands. I'm going to don my personal protective equipment. And introduce you to some injection devices. First thing we're going to do is an intramuscular injection. We're going to take our vial. We're going to check it for any discolorations. We're going to look and check for our expiration date. Make sure our medication matches our medication administration record. Make sure you clean off the diaphragm of the vial. You need to open up your device. The equipment and supplies that you may use will vary according to the facility. You want to hand over hand uncap according to OSHA standards. And since this is a vial, I want to put in the exact amount of air of medication that I'm going to take out. And to do so, I need to leave the vial on a flat surface, introduce the air, flip up my vial, draw back my medication, want to get out any air bubbles, make sure I've withdrawn the correct amount, break my seal, want to clean my site, want to hold the skin taut, I want to enter bevel up, aspirate, inject, remove the device, activate my safety device, turn, and dispose of my equipment. I'll repeat the procedure again. Again, your supplies will vary according to your facility. Again, I want to draw up the same amount of air as medication I'm going to remove from the vial. For demonstration purposes, I'm going to clean the vial again. Raise my vial, draw back my solution, tap out any air bubbles, break my seal, clean my area, hold the skin taut, bevel up, aspirate, inject, remove the device, activate the safety device, click, and dispose of properly. The next device we're going to use is a vantage point. Again, for demonstration purposes, I'm going to clean off my vial. Hand over hand, uncap. And either withdraw the same amount of air to my syringe. Inject the air. Invert my vial. There's the air bubble. Break the seal. Clean off my client. Load the skin taut. My bevel up. Aspirate. Inject. Withdraw the device. Then I want to activate my safety syringe and dispose. I want to activate the safety device again for you. It doesn't happen so quickly. Hand over hand, uncap. After I've injected and pulled out, there's a green button on the end, which doesn't get activated while I'm injecting the medication. I want to press on the green button, and it retracts the needle. And then it's ready to dispose. The next device I'm going to use is an EnviroSnap device. It's another safety device. And hand over hand, uncap. I'm going to pull the cap away from the safety device. I want to draw up the same amount of air as medication I'm going to remove. Keep the vial down flat. Introduce the needle. Introduce the air. Invert the vial. Draw back my solution. Tap out any air bubbles. Break my seal. Cleanse my client. And make sure my bevel's up. Skin taut. Aspirate. Inject. Remove the device. You want to activate your safety device by pushing the syringe in all the way and then disposing of it properly. I want to show you that safety device again for this particular syringe. The barrel engages into the hub, and then you can no longer withdraw any type of medication from it. So I'll show you an unused one. I'm going to engage it like so. Snap, and then I can no longer use the barrel to withdraw any kind of medication, and then it needs to be disposed of properly. The next device is a safety lock device. And I'm going to clean off my vial. Clean off my client. Hand over hand. Uncap. Want to draw out the same amount of air as medication. I'm going to remove, put that amount in there. Invert the vial. Withdraw the medication. Tap out the air bubbles. This is a subcutaneous injection. Again, I have bevel up, so I want to pinch up the skin, aspirate, inject, remove, and I need to activate my safety device. This device, I'm going to pull the barrel up over the needle, like so, twist, and then dispose of properly. And I'll show you that again. It's the safety lock system. Hand over hand, uncap. Always remove the cap from the sharp pointy thing. To activate the system, I give my injection, and then I pull the barrel up over the needle. Slide it in place, You'll feel and hear a click and then dispose of it properly. Okay, now we'll move on to an ampule. You take your ampule. You want to check, make sure it's the correct medication. Make sure you check your expiration dates. Tap down all your medication from the top. Make sure you cover it with 2 alcohol swabs, and you want to snap away from you. Dispose of it correctly. I'm going to hand over hand uncap. I'm going to introduce the needle into the ampule, and then I can flip the needle up and slowly withdraw my medication. You'll notice I don't have to put air in this. I'll make sure I have the correct amount. Cleanse off my client. It's an IM injection. I'm going to hold it taut, bevel up, aspirate, inject, activate my safety device, and dispose of it properly. The next thing we'll move on to is insulin. We're going to mix some insulin. You want to check your NPH and your regular insulin. Make sure it's the correct ones. U100 to go with your syringe. Make sure you check your expiration dates. You want to mix both vials. And when you're teaching the client, you want to teach them to mix both because you have to mix the NPH, and it doesn't hurt to mix the regular. So that way your client doesn't have to remember which one to mix and which one not to mix. Clean your vials. You get your insulin syringe. Hand over hand uncap. Draw up the same amount of air as medication you're going to remove. And you want to do the cloudy one first, whether it be NPH, lente, semi-lente. You never mix a short-acting insulin or a long-acting insulin. I'm going to put air in the cloudy one first, and then air in the clear. And then I can invert my vial. I'm going to draw up the same amount of insulin as air I've put in my syringe. I want to disengage the needle. You'll notice I'm not putting my hand on the plunger. Invert the vial. Draw back the correct amount of medication. Make sure I clean off my client. This is the subcutaneous. So we want to pinch up the tissue, make sure the bevel is up. I don't have to aspirate. Since it's subcutaneous insulin, I can inject, remove the syringe, activate my safety device, and dispose of the needle properly. This completes injections.